This is my camera. Let me know when you're ready.
This is mine.
2, call me. 1.
Hey guys, good evening. It's Dr. Triggs here, host of Triggs Table Talks. Today I have a great guest. I have Dr. Randall Thompson, an entrepreneur, physician, and thought leader who's redefining what it is to be a medical leader in this space, an entrepreneur. So with that being said, Dr. Thompson, thank you for being here, brother.
Thank you for having me, man.
So I was supposed to have seen Dr. Thompson months ago. I was like, yeah, my schedule is a little bit light on Monday, so I'm gonna come in and get adjusted, especially like my shoulders and my neck from bending down all the time. And it's Monday, but it's been months later, and I still hadn't got up on the table. So, but I got him here on Triggs Table Talk. He has a dope Instagram profile, social media profile. He does incredible work, and is an excellent entrepreneur. And so we're going to dive into that today. So, Dr. Thompson, man, take us to the beginning. What made you want to become a physician in the first place? And then, especially going into chiropractic medicine.
All right, so my dad's a chiropractor, actually.
Oh, wow. Okay.
Yeah,
legacy? Okay.
Yeah, I'm legacy. So, I didn't want to be a chiropractor growing up.
Okay. What'd you want to do?
I want to be an actor.
It explains it. It explains the social media then. That's perfect.
I want to be an actor. Then I met an agent in Miami,
Mm-hmm.
and then I didn't want to be an actor anymore.
Oh, wow. Oh, it was, what did he do?
It was very weird.
Oh, yeah. Some Diddy stuff.
Yeah, it was some Diddy stuff in South Beach, and I was like, you know what? Back to chiropractic school I go.
Here we go. What school did you go to?
I went to Florida A&M for undergrad.
Okay.
And then I went to Palmer College of Chiropractic, and I went to one in Daytona Beach, Port Orange, Florida.
Okay,
That's where I went.
gotcha.
Yeah, but my dad, I got to watch him help people as a child, right? So I watched people walking there, bent over, crying.
Mm-hmm.
They can't help me here, they can't help me there. And I watched them get up, leave his office, smiling.
Yeah.
So people could say it doesn't work, it doesn't this. I've seen it growing up.
Right.
Even myself, a lot of people are afraid of, even you said you're afraid of getting your neck adjusted, which rightfully so.
Yeah.
Right? I grew up watching Van Damme movies my whole life, and Schwarzenegger and all that stuff. So it's like, you don't want to get Steven Seagal, but it's not that.
Right.
But even when I was young, I didn't believe it worked. And a lot of people still not going to believe it worked, and it's fine. But I didn't believe it worked till I had a crick in my neck. I had neck pain. I was 6 years old, and I hated getting my neck adjusted. And my dad said, man, just sit down and shut up. And I couldn't take it no more.
Right.
When I couldn't take it no more, I was like, just do it. And he adjusted my neck, and I didn't have any more pain. I was like, okay.
Yeah.
Well, it works. And people were like, well, that's a placebo. We need a study. We needed this. We needed that. We live in an age where everything needs to be so planned out and so this, but it's like, it worked. You can't tell me it didn't work. And I watch it work on my patients day in and day out. So, and then after that, I was like, okay, well, it's not that bad. So I always kept it in the back of my mind, and then I became a chiropractor.
Yeah, love that. So, when did you realize you love hearing the bones crack online?
It's crazy. My first neck adjustment, because I was adjusting people before I was actually in chiropractic school.
Okay.
My dad would show me how to do it.
Okay.
And, you're not supposed to.
I was going to say, you practicing medicine without a license?
For sure. They can't get me, though. It's too late.
Yeah, statute of limitations.
Statute of limitations is over 20 years.
Gotcha.
Over 20 years. But no, I would practice, because my dad would show me stuff. So it's like, you have to learn this stuff early. Right? Like, your first surgery, I'm pretty sure wasn't your best surgery.
Right.
And the last thing you want to do is see this dude pull up and it's like, oh, it's my first day.
Exactly.
I might have lift your boobs.
Right.
One might be by your eye, one might be down here. So, but I was practicing early, but the first neck adjustment seemed like it was so scary for me. Because the same way you're scared to get it done, I'm scared to hurt somebody.
Right.
Right? So it's like, but somebody actually grabbed my hands and did it for me. And I was like, oh, it's not that bad. Then after that, it's like you kind of sort of look for that. But the actual popping doesn't mean that the adjustment was successful. That's just gas being released.
Okay, gotcha.
Because it's not like we're actually moving the bone from here to across the street.
Right.
But that's what people think.
Gotcha. So how do you feel about when you watch those chiropractic fail videos when, someone says, I can't feel my leg and, all that kind of crazy stuff? How do you feel about those?
So those, all right, so that's a tricky thing, right? Because they never tell you who the chiropractor is. They never tell you where they went. It's always this story of, or some nurse, I've seen so many of these happen in my... Tell me who.
Right.
Give me the name. Right? Because I've met a provider, and they called him the Boston Butcher.
Mm-hmm.
And this man did so much dangerous things to people, it was on the news.
Oh, wow.
So you can put a name to it.
Yeah.
Right? Put a name to the chiropractor. Let me know who did it. Now, it might have not been a chiropractor.
Right.
I've seen a video where it's a homeless guy in New Orleans. They calling him an ex-chiropractor. No, bro, you're in the back alley letting a homeless dude rub on your neck. Oh, now he caused the issue. But that was a chiropractor. No, he's homeless, bro. Why'd you let him touch you?
Right. What are you doing here?
What are you doing here? Or why did you go to the $20 $20 place that gives you a barcode and you walk through? That's something happened to you? Hey, that's on you, man. You go to McDonald's, sometimes your fries may come out cold. That's not my fault, but you still good, right? Right? So you can go there if you want, but you might want to find somebody who's legit.
Understood.
I seen a $1,500 BBL advertisement.
Yeah, we're not doing that. I don't even know how you get paid off of that. You take home like $50.
Hey,
you might as well be working in a...
So if you come out with one butt cheek, who fault?
Hey, man, hey, somebody gotta have some accountability around here. What's like one of the biggest myths you've like seen in your field?
The biggest myth is that we kill people.
Yeah.
That's the biggest myth. And if we did, our malpractice wouldn't be so low.
Mm-hmm.
So our malpractice is so low, it's like I could pay like, some people paying like $1,000 for $1 million coverage.
Mm-hmm.
Why would they cover me for $1,000 for $1 million coverage if I'm killing them people all the time?
Right.
So, the problem with most chiros go down for, it's not for killing people.
What is it?
It's for touching people.
Oh, like those cringe videos where like, I'm gonna pop their tailbone.
That's why I make those type of videos.
Yeah.
Because that's why chiros go down. Mm-hmm. Mainly, they get too close. It's a little inappropriate, and then people just. I heard some stories. Now that stuff, I got some names, some stories.
Oh,
yeah, I know they be cutting up.
They doing the most.
They close that door, man. Ain't no telling what getting popped. Not here though. Not at my spine clinic. Keep clothes on.
Yo, that's crazy.
That's the crazy. If they get it right, if they was like, hey, chiropractors be freaky. You got a point.
Yeah.
Killing people? No.
All right. Well, we didn't clear that up. All right, we're gonna play fact or cap.
All right.
Chiropractors can paralyze you.
Fact and cap.
Yeah, and you just went through that.
Yeah.
Once you start in adjustments, you can't stop.
Cap.
You can stop about that. That popping sound means your spine is fixed.
Cap.
There you go. But what you were about to say, something I cut you off.
Yeah. So, can they paralyze you? Yeah, they can. Mm-hmm. But they're supposed to do. All my patients get X-rays, except for like really young children.
Okay.
So if somebody comes into my office and they have a bone fusion, or if they have a previous surgery and I don't know about it, and I see the scar and I still ignore it, and I go in there and I hit them hard, or let's say they come in and they have a cancer, and I didn't shoot an X-ray and they got metastatic development, I didn't see that, or if they had a aortic aneurysm,
right,
and they have signs of it, and I ignore it, you're done.
Right.
It's a dangerous game.
Yeah.
But you're supposed to examine them. You're supposed to talk to the patients. Yeah. That's why you don't go to the $20 places.
Right.
Because they're not shooting X-rays. They're going in there, they may ask a few questions.
Right.
And if they don't, but if there is something that's seriously wrong and you do it, then yes, there will be a problem. But in most cases, it's not.
Right. Yeah. That's a good question. That's a good place. Chiropractic is just placebo with better marketing.
Yeah.
So it really works, huh?
It really works, bro. But everybody's not good. Some people are supposed to be plumbers.
Yeah.
Some people are supposed to be plumbers. Some people are supposed to be barbers, but they went to chiropractic school.
Yeah.
What percentage of the medical profession do you think is good?
Oh, I think it's just like a bell curve. I feel like probably 20%. It's like 80 to 100, you know what I'm saying?
So you think 20% is good?
Yeah.
So 80% is bad?
Yes. Oh, no, I would say bad. I think it's like a bell curve. So like from, once you hit about 60%, you know what I'm saying? It's
60%, you flipping a coin.
Yeah.
So are you nervous to go to the medical doctor?
No, I'm not.
With 20% good?
I feel like I researched my doctors, though.
Okay. Yeah.
I researched mine.
You find the 20%.
Yeah.
But Most people don't get an opportunity to research.
That's true.
They're walking in and they flipping a coin. So they're getting the bell curve, which may be at the top.
Yeah.
Or maybe at the bottom.
Yeah.
Do you know anybody that was injured from a medical mistake?
No, I don't.
Now ask me.
Do you know any?
For sure.
For sure.
For sure. I know a few, right? And do you know anybody that was injured from a chiropractor?
I do not. I got a cousin that goes like damn near once a month or every 2 weeks to get her shoulder or something adjusted or something.
Fact or cap. But then they'll say, oh no, it's placebo, it's this, it's that, what's the research? Well, I mean, look, you said it yourself. All of them aren't good.
Yeah.
Ask me how many chiropractors I think are good.
How many?
The same thing, man. A lot of them, they trash.
Yeah. They just in there trying to make something
especially
pop.
them COVID doctors.
Because they didn't get hands-on.
Shaking.
Yeah.
Now, I ain't trying to knock them. Some of them get better.
Yeah.
But like you gotta get in the game, right?
Yeah.
And I'm pretty sure you see a lot of young docs. You're like, bro, like, stop shaking.
My program director used to say, surgery is a contact sport. You got to get the reps. Got to get the reps. And a lot of people want to skip steps. Yeah.
They want to skip steps. They want to go from 0.0 to 0.3. Right. And a lot of people do that and become great business people and make a lot of money and do a lot of surgeries and mess a lot of people up.
Yeah.
McDonald's.
That's McDonald's. There you go. We'll stay away from. Well, that was our edition of Fact and Cap, ladies and gentlemen. Some people swear one session changed their life. Others say it's dangerous. Why do you think the internet loves the drama around chiropractic medicine so much? Is it just clicks or, a clickbait type deal or?
I got a couple theories, right? The AMA has been after chiropractors since they started, right? But why isn't the AMA after DOs? DOs, you know the history behind DOs, right? So DOs started like chiropractors.
Okay.
DO in DC was right there.
Yeah.
So if you look at a DO in Europe, what do they look like? They look like chiropractors. So why don't they hate the DOs in Europe, but they love the DOs here? Because the DOs fought for the right to give medication and practice like medical doctors. So that's why they do surgeries and things like that. And people are like, oh, well, that's a doctor because it's surgery and it's medicine. But it's a DO. They learn just like us. The difference is the DOs thought that the body was controlled by blood. Chiros thought that the body was controlled by the nervous system. We were right. They were wrong. But they practiced with you guys. So now they're smarter than us.
I didn't know that. I didn't know that at all, actually.
Most people don't talk about it. Look up a DO in Europe right now, and you'll see them doing manipulations.
Right.
So it's manipulations versus adjustment. It's just different things, and it's minutia, and people like to... We're the ones to steal on. And plus, it's a lot of wild chiropractors saying a lot of wild stuff like that. Don't get me wrong. Everybody says wild stuff, but it's wild MDs that say stuff too, because they'll say, well, a chiropractor killed somebody, da-da-da-da. Show me.
Right.
They don't debate us, But, I try to stay away.
I got you.
I like to fight, bro. So it's like, it's two questions. I'm going to say, bro, let's go in the ring, bro. Because I don't like your tone. I feel like you're condescending me. We could just wrap hands up.
I don't like what you say right now.
I don't like these words, man.
Oh, man. Have you ever had a patient come in terrified because of something they saw on social media and then you completely changed your mind after treatment?
All the time.
That's probably the bulk of your practice, huh? Or at least your new patients.
Oh, yeah, for sure. It's like, I've had people cry before I touch them. But they're in pain. So they're like, do something. Right. I'm tired of taking Advil. I'm tired of taking Tylenol. I don't want autism. I'm tired of taking...
You said, I don't want autism.
I'm tired of taking ibuprofen. Percocets.
Yeah.
Right? Percocets is close to heroin.
Yeah.
But why isn't that vilified like a chiropractor?
That's a good point. And how is insurance coverage for you?
Shit.
Yeah, I can only imagine.
That's why the DOs fought to be like that. Because DOs get paid way better than we do. So it's like we don't get paid much. And this is why a lot of chiropractors scheme and scam and do a lot of things like that. Because they have to keep the lights on.
Right.
But it's still not right. But it's not right for insurance companies to pay $40 for an adjustment and $2,000 for a back brace. That costs $40.
Right.
It probably costs $1 to make.
Right. So Is there anything that you've seen more of since you've been practicing? So, because I'm hoping you read my mind type deal. But I feel like as this generation or even our generation is like big into their cell phones, this whole terrible posture situation or looking down or whatever. Are you seeing more neck pathology because of that, or you feel like it's pretty much the same since you've been practicing?
I feel like it's somewhat the same, but what I'm seeing a lot more is younger people with sedentary lifestyles.
Okay.
So a lot of obesity, which obviously is your business.
Yeah.
Y'all booming.
I ain't gonna lie to you.
Y'all booming. Well, because social media leads to, like, I would have patients come in like during COVID, after COVID, be like, I used to work out, but I stopped after COVID. Now I have depression, now I have anxiety, now I have this, now I have that. And that's also gonna lead to pain too.
Right.
So in chiropractic, it teaches 3 things called illness: thoughts, trauma, and toxins.
Okay.
Right? So if you got bad thoughts and you got toxins and you got trauma, and that's what everybody gonna have. And I think because of the whole society and the sedentary lifestyle, the working from home, the Zoom, all that stuff has led to more illnesses and more injuries.
Okay. What is something that you treat that most people wouldn't think that you actually treat?
So we treat a lot of migraines, headaches.
See, I wouldn't have thought that.
Yeah.
I mean, it makes sense now, but yeah, I wouldn't have thought that right off rip.
Yeah, because it comes from the neck usually.
Yeah.
And a lot of times it also actually comes from the diet. Jolly Ranchers. Doc.
Damn, this is the second episode somebody went in on the Jolly Ranchers.
Jolly Ranchers, Doc. Also, let me see, what do I treat consistently? Babies. A lot of people don't think.
No, I definitely didn't see that coming.
Yeah, so we treat a lot of babies that have trouble with constipation, sleeping, irritability.
See, I would have thought anything. I was thinking like torticollis or something like that.
Even that.
Wow. Okay.
Even that. So you bring your baby in, your baby's stuck. Okay, the birthing process is very stressful. And so each baby is different, right? But the chiropractic adjusts for a baby is not like the chiropractic adjusts for an adult. We are not jumping on them. It's very light, stuff like that.
Do you do babies in your practice? Okay.
Anything but dogs.
Okay. Yeah, I've seen the veterinarian chiropractors over there twisting.
My man was
cow
adjusting
heads.
lions.
That ain't you, bro?
No. That's not my complexion.
I pay money for that. I pay for the plane ticket. Let's go to Africa today.
But it's a lot of chiropractors that do horses that I went to school with. They do horses because that's big in the jockey world, actually. So people bring that chiropractic to the horse racers. They're
the derbies and stuff.
Derbies and stuff like that. Yeah. And if it works for them, how can you disprove that?
That's crazy.
A lot of athletes, things like that. Obviously, that's the norm.
Yeah.
Yeah.
Hey, hold on. This snuck in here. That's not the right question. All right. Damn, sorry. My questions got me. Oh, you talk a lot about trusting the body to heal itself. What's one thing that people totally get wrong about pain and healing? Or get misconstrued?
Pain is what you see last, right? So people think when I have pain, I should go. But pain shows up last. Like, even like, let's say if you tear your Achilles, right? Yeah. Don't want that to happen to you or anybody.
Right.
But the pain comes last.
Yeah.
The issue has been there for a long time. You weren't stretching, it's overuse, the calf is tight and things of that nature. But once it pops, that's last.
Right.
The inflammation is last. So people try to chase pain instead of actually working on continuously helping their body to be in a better structure and a better function, opposed to waiting for the actual symptom to come about and rear its ugly head.
Right.
It's like, I have back pain now. Yeah, you've been a bus driver for 30 years. You should have been getting treatment before that.
Right.
I got a back pain now. Well, of course you played football for 10 years and now it's excruciating. You can't walk, but you never got any treatment for it. So.
Hey, that makes sense. So I've been telling myself, and this was in residency, I was like, you know what? I'm going to start like getting full body massages every 2 weeks because I got paid every 2 weeks. I got paid bi-weekly, a little small chump change or whatever. And my wife at the time when I was married was like, yeah, you should do that. Man, I did that one time. And then life just kept on lifing. Like even now, I'm like, yep, I'm going to get weekly massages, get these sports massages or whatever. Still haven't done it. Or like, with you, I'm like, yeah, bro, I'm going to pull up on Monday. Like my neck hurts. You ain't seen me since.
You got to take care of yourself first.
Yeah.
Because at the end of the day, you get PTO.
What, paid time off?
Yeah.
No, I eat what I kill out here.
So what is the most important asset for your business.
Me.
Exactly.
Myself. Yeah.
So if you're not taking care of yourself, you're being a horrible boss.
Yeah.
So take care of yourself first, then you can make more money.
Right.
Yeah, you may pull back a little bit, but in the long run, you'll never have to miss a day because of neck pain.
Good point.
That's the last thing you want. Oh man, I can't come in. I done miss, and I see I got a lot going on out there.
Yeah.
You miss a lot of money
Yeah.
for taking an hour out your time, maybe 45 minutes, something like that.
Right. Right. Bet. How does what you do connect with Dr. Triggs does? Surgery, recovery, posture, mobility, and confidence.
Whoa, shoot. I mean, if you think about it, bro, y'all lifting people up.
Mm-hmm.
And y'all helping people feel better about themselves. Because I can't do that, obviously, the way that you do. But at the same time, it does change their body biomechanics.
Mm-hmm.
So they still should seek some chiropractic treatment because things aren't the same.
Right.
If you were, if you was 120 pounds, and the next thing you know, you become 140 pounds,
Right.
or 135 pounds because some stuff got moved around and some stuff got added, then your body biomechanics may be a little bit different. So you might want to get adjusted. You might want to keep everything in line.
Right.
So
in a perfect world, how we get we get like a and when you're younger, you get like an annual physical or whatever, get your lab work, make sure everything is good. In terms of seeing like a doctor of chiropractic medicine, would you suggest like at least once a year, almost like you see your primary care once a year to see if you're good, or if you're more active, should someone be going to see a chiropractor like maybe twice a year, or or at least an initial exam?
Initial exam, I would think you should try once, but then also you may want to try different chiropractors. I may not be the fit for everybody, right?
Yeah.
So I wouldn't put a once a year, twice a year. It depends on what you actually have, right? So let's say you're doing surgeries. How many? What's the most amount of surgeries you did in a day?
I'd say like 8.
8 surgeries. How long did that take?
It's like 13 hours, 14 hours.
14 hours. You think you should go get adjusted once a year?
Man, maybe like once a month.
Maybe more than that, because that's a long time of standing, bro.
Yeah.
Standing, leaning over. Like, you're going to constantly be developed slight micro traumas from doing that over and over and over. So you may need to get assessed. It may not need to be your neck all the time. It may not be your low back, but you're going to need some type of soft tissue work consistently.
Mm-hmm.
So, I mean, like, you the money maker, like I said, bro. Like, how much are your hands worth right now?
Yeah. And
you're not doing nothing to them.
That's a good point. Hey, man, we feel bad, man. Like, I need to go get adjusted right after this episode. Shoot. Let's see. Let's talk about these miracle crack videos where someone walks in limping and walks out doing the bachata. How real is that? Well, you kind of alluded to it earlier, like when your dad, when you first started seeing people coming in and stuff like that.
Yeah, it is real, but it's not every patient. Okay. I would like for it to be every patient.
Right.
But it's not.
Percentage-wise, what would you say?
Percentage-wise, I would say...
Or maybe like a patient a week or something like that, or a patient a month?
The thing about it is tricky, right? Because some people want to feel better. They want to be that miracle. Yeah. They want to be that miracle patient. So it's tricky, right? So it's like, yeah, they could want to be that miracle patient, but then I got some people, I'm like, bro, why didn't you come back? I'm like, bro, I felt better. I'm like, but still.
Yeah. We got to maintain here.
Got to maintain. No, I'm good. I'm like, all right, well, what could I do, right?
Yeah.
So I would say about 45%. Give you a real miracle.
Yeah.
Well, nah. Yeah, but that was like, I see stuff like where people can't walk at all. Mm-hmm. But it's not going to be just one adjustment. Because we do physical therapy along with that.
Right.
And a lot of people, they praise physical therapists. Mm-hmm. First physical therapist was a chiropractor.
Oh, I didn't know that.
We deep in the game, man. Chiropractic.
People just don't know.
They just don't know. And that's why they can't get rid of us. That's what people are like, well, you can't say this and you can't say, we deep. We've been around.
That's crazy because I feel like I need some physical therapy on my hip, but that's another story.
Man, you gotta get that right, man.
Yeah, it's tight, man. It's tight.
That's a mobility issue.
Mm-hmm. For sure. It's definitely mobility.
We get you right with that too.
Man. Miami spine. I need to just pull up, sound like it. I'm coming, man.
Hey, I work 6 days a week.
You work on Saturdays?
I work on Saturdays, man.
You should have told me. I could have been there this past Saturday. I was at the crib, just sitting down being sedentary.
Making scallops.
Eating Jolly Rancher gummies and watching Dexter. The most randomest things. If you could ban one chiropractic trend forever, which one would it be? This is like my favorite question out of all of them. Take your time, because like I said, that was my favorite question out of all of
What
them.
can I ban? I don't want to knock the Y strap, because the Y strap isn't a chiropractic thing for an adjustment. It's actually the Y strap is meant for. You ever seen the Y strap?
Yep.
When people yank.
Yep.
That's not how it was designed. It was designed by Pettibon, which is a team. Well, it's a group they treat scoliosis. So it's actually supposed to just be a traction where they just slightly pull. Guys do it. They yank on it. They do all this stuff. It's not taught at school. It's not taught at any school.
Right.
But people do it online.
Yeah.
I don't want to
knock it. It's a bad rep. And it seems like associated with y'all's specialty too.
Correct.
Yeah.
It's not taught at any school. People are like, you don't do it? No, I don't do Y strap.
Yeah.
But I know people that do it, and so people say they have great results with it. That's why chiropractic is so murky, bro. So, but I wouldn't be that. But it's like, I see a lot of weird stuff, a lot of thumb in the butt stuff.
Yeah, I saw that when you posted. I was like, people really doing that? Like the tailbone thing? But
that's an actual adjustment.
Really?
That's actually taught in school. Not those guys, though. That's for the coccyx. If your coccyx is messed up, they say it's so bad that they have an internal coccyx adjustment where they actually put their finger inside the butthole and pull it out. I won't do it. I refer out.
What are the symptoms that would justify doing that type of adjustment?
I guess like a falling like on the tailbone, like on the coccyx, and like to where it's actually subluxated, and they would actually need to pull it. And it's painful. The adjustment is painful. The pain is excruciating that they would be in for them to need that. But I can't ban that either. So it's like,
I'd be like, man, put me under for sedation.
What I would ban is these $20 adjustment places.
Yeah.
These franchises. And I would also
You see them a lot, too.
You see them a lot, right? But you don't know who you're going to get when you walk in. If I was to walk in here and say, who's the random surgeon for today? Because I get a $1,500 BBL, I would want that banned.
Right.
But that is what I think needs to be banned. Franchising healthcare, because that's what happened to, because I was told by somebody that medical doctors don't even own the hospitals, correct?
No.
So
it's all big corporations.
So how's the ethics with that then?
It's the dollar over the patient.
It's the dollar over the patient.
Yeah.
So if it could be flip-flop, that would be better health.
Right.
The thing about it is when you got corporations owning these things, it's going to be the same type of thing, and this is why the patient outcome may not be as good.
Yeah. The new I saw an article a couple of weeks ago, and they were talking about how a lot of the hospitals that are owned by private equity firms are having worse outcomes, which is kind of like, yeah, water is wet. We knew that was going to happen. Like literally, I think that article came out like 2 or 3 weeks ago.
Why are they allowed to do it?
Yeah, big money.
Lobbying
Congress. You can do whatever you want to.
You could be a part of the Senate. Not gonna say no names. I don't want them coming after me.
Yeah, because they will now.
Because they will. I don't say too much no more.
Yeah, I'm just gonna be quiet. So what's one thing that you feel like should be more common, or like people should seek out more commonly outside of just coming in for a random adjustment or just an evaluation? Is there one procedure that you think everybody could benefit from, or an adjustment?
I mean, we do a lot of other soft tissue stuff too. So it's like, even if people are afraid of the actual adjustment, we have a bunch of other physical therapy things we can do in our office and soft tissue. So it's like, everybody doesn't get necessarily an adjustment from our office.
Right.
So it's like, it's
like a tailor-made approach.
Yeah, it's a tailor-made approach, and everybody thinks that that's what you get. You go in a chiropractic office, you get this, and you get this alone, because that's a perception. But I'm not usually posting all of those things either, because who wants to watch somebody do 90-90 hip mobilities or low back extensions for their back pain? They're not going to click on that video.
Right, exactly.
And that's what chiropractic, we have. The thing about it, right, we're the only profession that posts before and after, and people still say it's fake.
That's a good point. That's a very good point.
People still say, where's the research?
Yeah.
But if 70% of this profession is on social media now, and 70% of the profession is posting before and after with actual people giving testimonials.
Yeah.
And people are saying, that's fake.
Like, nah.
You kill people.
Yeah.
Well, then where are the bodies?
Where are the bodies?
Show me. My backyard not that big.
It's a watery grave out here.
That's what I'm saying.
So into your personal life, I see that you're into fitness, kickboxing, and mobility. How much of your work is about prevention rather than treatment?
It's definitely mainly about prevention. I should do more prevention for myself, to be honest. I'm not the best at that, the same way you are. It's like you working. Do you have time to take care of yourself?
Right.
If I barely make time, I got my chiropractor in my office. He adjusts me once a week. I adjust him like once or twice a week. But if it wasn't readily available to me, would I be like that?
I need Vixen to hire a chiropractor so I can just walk right across, or even just in the building. So my dentist is in this building because I had a toothache one time. Shout out to the Jolly Rancher gummies. Well, actually, I was eating Twizzlers, but I stopped eating Twizzlers.
Come on, man.
It's a real story. This happened like a year and a half ago. I used to eat Twizzlers big time. Like I love Twizzlers. It was one of my favorite candies. And I'll tell you why I stopped eating them. But anyway, it wasn't the root canal that stopped me because I was still eating them. And so I was like, I got a toothache, but I had a busy day. So I was just trying to find a dentist like around the area. And I was like, there's one in the building. So I went right down to the 6th floor and they got me right. And I've been going to her ever since. And but anyway, the only reason I stopped eating Twizzlers was because somebody sent me a meme saying if someone eats Twizzlers, they chew on HDMI cords. And after that, I was like, I'm done. I can't be eating these candies no more. But I still like them because one time I went to the movies with the twins, I ate some. But anyway,
a meme saved you from Red Dot 40.
Yeah, basically, and I would still eat them if it wasn't for that meme. And but no, man, if there was a chiropractor on the 6th floor or in this building, the convenience, it'd be great. Should open up another office just right here.
Where we at? What's this location? What is the area?
5040.
No, what's this area called?
Are we technically Coral Gables or no?
We're Coral Gables?
Yeah, I always like when people ask, I always say, I'm by the airport, kind of like the border of Coral Gables.
Let me sublease some space. I'll figure stuff out. Man.
Yeah, get one of the exam rooms, right?
Yeah, y'all are using them all the time.
Yeah, on the slow days, just come in on Mondays. Yeah, we got chiropractor come in on Mondays. The patients will love that. You can do medical clearances and everything.
Yeah, hey, sure. Yeah, I got the best type of clientele.
There you go. There we go. We're winning. But man, what's one daily habit everyone could do at home to avoid needing to see you? Need to see you so often?
Sitting down. Sitting down is one of the worst things you do for your spine. So standing up and laying down is the better option. People sit so much. Yeah. Like I said, like with working from home, Zoom work, all these things, people sit down on their phone all day long. They don't take any steps. So moving around, but people just sit too much, and sitting down is horrible for your spine, and looking down at your phone, looking at the computers, being sedentary. So you can get up and walk every 30 minutes. Yeah. That'll help just give you some motion throughout the day, and that should help you not have to go to the chiropractor.
Yeah, I know some people, they have like these stand-up desk, or they have like the little stand-up desk, but they have like a little peddler or a little mini treadmill. I heard that helps too.
All those things definitely help.
Yeah. I don't know if I can like talk and chew gum. So like, I don't know if I could be at the desk and being on a little thing, man, I'll fall down or something. Does your back ever hurt, or are chiropractors built different, pun intended?
Oh man, I'm in pain all the time.
From what? Oh yeah, you be kickboxing and stuff.
I be kickboxing, I get my daily dose of CTE, I be sparring.
Oh, you be fighting?
Yeah. Right. That's why I say, man, I like to fight. Like, so like that's why I don't like to debate.
What? You out here getting pummeled?
Hey man, the pummel is crazy. That's crazy word. No, we really spar. We really get at it. Like, the gym across the street from my office. So it's like, but that really have you locked in. I don't know if you ever sparred before.
No. No.
It's like I golf. I'm not doing that.
I own a pistol for a reason.
The thing about sparring, when you in there fighting with somebody, there's nothing else going on. Right. It's you, it's them, it's survival. But it's not real survival, but it's simulated. So if you could simulate it, just like if you was to simulate, drawing your pistol. Yeah. You won't be good just doing it one time. Exactly. You got to do it multiple times. Yeah. Also, most gunfights start off as a fist fight. So if you're not used to being under stressful conditions, you may not even draw.
Right. Yeah. That fight or flight is a real thing. Sympathetic system start kicking in.
I'm trying to tell you. Especially if you're not adjusted. Everything not flowing right.
Well, Randall, man, I appreciate you being here in Triggs Table Talk, man.
Man, thank you for having me come by, man. I appreciate that.
If people want to get in touch with you, learn more about you, like what's your office number, social media, website, what's that, so we can drop that below?
Office number 786-661-0906. Website's MiamiSpineClinic.com. YouTube, Miami Spine Clinic. Instagram, Miami Spine. TikTok, Miami Spine Rand. Snapchat, same thing. I'm all over.
Oh, perfect. Well, man, I really appreciate you being here. I'm pulling up on a Monday. I'm coming Monday.
How many videos you shoot on a Monday? He lying?
Like 3, but it's not every Monday.
Okay.
But I'm coming, man, and we're gonna.
Or you come Saturday.
That might actually work. Man, I wish I would have known this week because I definitely would have been there this weekend because I actually sat at home just to rest
up. Out of town?
I'm usually going, yeah. So this was like the rare Saturday where I was actually in Miami on the weekend and didn't do nothing. Didn't have nothing planned.
Dang.
I started going out to eat.
But you need that sometimes, though.
Yeah, you do. I need it. That's why, because I was supposed to be at a conference. But if you guys know anyone that may learn something from this, that are interested in chiropractic school or being a chiropractor or just the story, share, click like, subscribe. Also, I'm a plastic surgeon. We got bills to pay. Your consultation is completely free. Click the link below. And until next time, welcome to Triggs Table Talks, and I'll see you next time.